Hi, Kevin Sartin with Non-Master Physical Therapy with an educational video on hip fracture. So I'm going to kind of go through what might cause a hip fracture, the presentation, and then treatment options available. So hip fractures are most common in individuals over the age of 65. And fun fact for you, those over the age of 50, 33% of all women and 20% of all men will suffer a hip fracture at some point in their lifetime, which is quite a bit. As far as how a hip fracture might occur, it's typically going to be a trauma. So maybe you were in a motor vehicle accident, maybe you had a fall. Definitely would suspect this more if you have osteoporosis. And then some other things that you might not consider would be people who do repetitive stressful activities such as long distance runners, or even gymnasts, who have long periods of impact to their joints. They can suffer stress fractures in their hip. So what does a hip fracture present as? Typically you'll have severe pain in your hip, groin, buttock, or down into your thigh. If it is a hip fracture, not necessarily a stress fracture, you're going to have difficulty bearing weight through that joint. If the fracture is actually displaced, kind of come apart, you're not going to be able to bear weight, and that side will actually be a little bit shorter and rotated towards the outside. So those would be things that might indicate like, I need to go to the doctor right now. And then as far as a stress fracture of the hip, those are a little bit trickier. So those are not going to present the same way. They'll actually look more like a tendonitis or muscle strain. So those would have to be something that would be detected with imaging. So x-rays are going to catch, any of the obvious fractures. They might miss some of the stress fractures, though. You might have to have an MRI or CT scan to determine if you have a stress fracture. Treatment options I guess I should go into where a fracture would occur. I almost forgot. So typically it's going to be in the femoral neck. Get my finger back here. So the femoral neck, the neck of the femur, is where 40 to 50% of fractures will happen. And then about 30 to 40% are going to be intratrochanteric fractures. I said it. Look at that. And then the last little bit are going to be subtrochanteric fractures down here. And then as far as treatment options for fractures, if you have a stress fracture, it's going to be rest. You might get some PT, stop the repetitive activity that is causing stress to the area. If you have a hip fracture, you're going to have surgery. The different options available, so it might be an ORIF, or an open reduction internal fixation. This is where we're going to use maybe some rods or screws to pin that fracture back together. In this case, they'll keep your joint, so they'll keep the same joint, but they're just going to fix the fracture itself. You might have, if you already have arthritis, the doctor might suggest, well, let's go ahead and do a hip replacement. In that case, they'll do a total hip replacement. Where it's fractured, that's going to be gone anyways with the replacement that they put in, and you'll have yourself a brand new hip. If they aren't able to preserve, the femur with the fracture, but you still have a really good joint, they might do a partial hip replacement, in which case they'll give you a hip replacement on the femur part, but not the joint itself, and you'll still have your joint itself. And then in some cases, and this would just be someone's really frail and unable to tolerate a surgery, they might just suggest bed rest, which is not the ideal option. Obviously, we'd like to get that replaced so you can get back on your feet and going. And then following, that surgery, you're probably gonna get some physical therapy. So we're probably gonna see you. I hope this video was helpful for you. If you have any questions on anything or need help, please give us a call or visit us at our website at notpt.com. Thanks.